Hello, I'm Dr. Charles Dunn. I'm a general and vascular surgeon in Springfield, Missouri. We have been using the Veinoplus product in our practice for about a year and a half now, and have found it to be very helpful to our patients with peripheral arterial disease and chronic venous insufficiency. The first group of patients that we have found the product to be very helpful in is those patients with what we call non-reconstructible peripheral arterial disease in their lower extremities. Those patients have pain at rest, and there's nothing further we can do surgically or with an endovascular approach to correct their problem. In those patients, we prescribe the Veinoplus for them. They wear it 4 to 5 times a day for 30 minutes at a time. They get significant relief of their rest pain. They're able to walk around their homes. They're able to cut their grass, and they've had a significant improvement in their quality of life with use of the product. The second group of patients where we find the Veinoplus to be very helpful is those patients with peripheral arterial disease that are non-reconstructible but have open wounds on their feet and ankles. Those patients oftentimes end up with an amputation, and with the use of the Veinoplus device, we have, along with our colleagues at the wound centers, we've been able to get these wounds to heal. And these patients continue to be able to walk and ambulate, live independently, and have a good quality of life. The third group of patients that we find the Veinoplus to be very helpful is those patients with severe chronic venous insufficiency of their lower extremities. Those patients are classified as CEAP 5 and 6 patients that typically have venous stasis ulcers on their legs or chronic, what we call brawny edema of their legs. We will treat those patients' superficial venous reflux with an endovascular procedure to correct their superficial venous reflux, and that will assist in getting their ulcers to heal. But the second and very important part of that is some kind of compression on the lower extremities that assist in that wound healing. Our morbidly obese patients have a very difficult time wearing compression hose, and the Veinoplus is a valuable product to provide venous outflow from the leg to improve the wound healing in these patients. The compliance rate of patients that are morbidly obese wearing hose is very low, but they are much happier using the Veinoplus on a 4 to 5 times a day basis to assist in their wound healing, and then we'll continue to use that on a long-term basis to prevent those ulcers from ever coming back. The Veinoplus device closely mimics the calf pump mechanism in patients when they walk. The device causes contractions of the calf muscle every second in the patient and greatly promotes the outflow of venous blood from the leg and concomitantly increases the arterial inflow into the leg. By lowering the venous hypertension and venous resistance in the calf and the lower extremity, arterial blood flows more freely to the calf and to the foot, thereby improving the overall arterial and venous function of the leg. It's also much better tolerated than the pneumatic devices because patients can walk around with this device on. They don't have to be sitting stationary in a chair for hours on end during the day and can continue with normal activities. So we found patient compliance to be much better with this product than with the pneumatic devices. When patients come into my practice with severe peripheral arterial disease, I talk with them about the partnership that we are going to establish together to try and prevent them from having an amputation. Our goal is for them to live a good quality of life with their legs. These patients are often quite a challenge because they have multiple medical problems. We will work with them to stop smoking, to control their diabetes, their hypertension, to take their cholesterol-lowering medications, and to take aspirin. We also talk with them about what we call graded exercise, where they do a regular exercise program. Sometimes these factors are not enough, and we have to do either surgical or endovascular therapy to try and salvage their legs. And sometimes this even fails, and when this fails, the Veinoplus is a great tool for us to have to be able to help these patients live a longer quality of life and keep their legs. The Veinoplus device in our practice has been very helpful for our patients. The way the device works is it delivers electrical impulses to the calf 60 times a minute. This causes the calf muscle to contract and improves calf muscle pump function. That's critically important for venous outflow from the leg and to improve arterial inflow to the leg. We ask patients to use the device 4 to 6 times a day for 30 minutes to an hour. And we've had no complaints from patients about using the product this much. They start off at a medium level with the device, and then they can turn up the impulses as they wish, as they can tolerate it, and most patients have no complaints at all about that process. One of the great things about the product is its durability. In the year and a half we've been using the product, none of our patients have returned the product because it doesn't work. They change the batteries when necessary, and they are able to use the pads, which they change once a month. So overall, we've had great results with patients using the product. Not only do we have evidence from our patients of improvement in their pain and their increased walking distance, but we also have objective evidence with measuring ABIs and toe pressures in patients with severe peripheral arterial disease that after using the Veinoplus product, their ABIs and toe pressures improved, thereby giving us objective evidence of increased blood flow to the foot and toes. Patients with peripheral arterial disease and chronic venous insufficiency are complex patients. We use many different treatment methods on these patients, and we find the Veinoplus is an integral part of their treatment regimen. We find that it helps them increase their walking distance, decrease their swelling, and helps them heal their ulcers. Overall, it greatly improves their quality of life.